Hi, my name is Christina Ziebard, and I'll be presenting a meta-analysis that looked at exercise in patients with psychosis, as well as sharing some pearls of wisdom from a short placement that I had working in a mental health hospital. So, psychotic symptoms can present in people with schizophrenia and bipolar disorder, which can affect a significant proportion of the population. Psychosis is a symptom which is based on how the person forms their thoughts and the content of their thoughts. For schizophrenia, people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, extreme disordered thinking, and behavior that impairs daily functioning, which can be very disabling. Bipolar disorder causes mood swings, including emotional highs and lows. Treatment typically involves medication and can better treat positive symptoms rather than negative symptoms. So, positive symptoms are hallucinations, delusions, confused thoughts, disorganized speech, or trouble concentrating, as well as movement disorders. And negative symptoms include having a lack of pleasure, not not talking much or showing much emotion, withdrawing, or struggling to keep up with daily activities like bathing. And medication can have unintended side effects, including weight gain and metabolic symptoms. So, physical exercise is one option to try to address some of these cognitive, negative, and positive symptoms, as well as the associated weight gain with medication. So, the purpose of this systematic review and meta analysis was to investigate the effectiveness of exercise and physical activity on psychotic symptoms in people with psychosis when compared to usual care. So, we were looking specifically at randomized control trials and adults with psychosis, but specifically in a hospital setting. The intervention did have to be exercise or physical activity, and the comparison was usual care. And the main outcome that we were looking at was the positive and negative symptom severity scale. Studies were excluded if they weren't written in English, or if they were in a community setting, or if there was no full text available. And the risk of bias was assessed using the Cochrane risk of bias tool. A total of 23 articles were included, and 17 of these were used in the meta-analysis, which was pared down from a total of 603 for which we screened. The interventions involved running, walking, yoga, strength training, HIIT style workouts, so that's high intensity interval training, lifestyle interventions, or a combination of the two, so sometimes walking and strength training, for example. The comparators were usual or standard care, which often involved medication, walking, stretching, and education. In terms of the risk of bias, the blinding of the participants was rated high in all of the studies because of the nature of it being an exercise intervention. And attrition was rated low in almost all of the studies due to a high number of participants dropping out. The participants were between the ages of 18 and 65, with the average age close to 40, and most of the participants included in this study were males. The common intervention timeframe was 12 weeks, with the shortest being 3 weeks and the longest being 6 months. When looking at the meta-analysis, you can see that there is favoring towards the exercise intervention. So if you look at this plot, you can see that most of the effect is towards that treatment side. And these negative numbers on the bottom indicate a decrease in that PANSS score, which means that they're experiencing less psychotic symptoms. And overall, there was a decrease by almost 9 points, which was not only statistically significant, but clinically significant. And this was compared to usual care. There was quite a bit of heterogeneity, which was mostly explained by the duration of the intervention. So as I mentioned, most interventions were about 12 weeks, but some were 6 weeks, some were 3 weeks, and that creates some heterogeneity, and so that's captured in this plot as well. But really promising results to indicate that exercise can improve psychotic symptoms. When we did look at breaking this down a little bit further to get a better understanding of what type of exercises may be beneficial, as well as which symptoms it seems to address. And so there's 3 different plots here. This is looking at the total PANSS score for yoga versus no exercise, and there was no statistically or clinically significant effect here, but there were only 3 studies, so more work could be done. When looking at aerobic exercise versus no exercise, it's approaching both statistical and clinical significance, and maybe more studies would show a more promising effect for exercise. And then when looking at yoga versus aerobic exercise, it did seem to favor towards yoga, which is interesting, but again, not statistically significant or clinically significant. Now, when looking at just the positive PANSS score, so these would be the positive symptoms, which are better addressed by medication. You can again look at yoga versus no exercise, and it is favoring towards yoga, but not statistically or clinically significant. Same with aerobic exercise compared to no exercise, again, favoring towards exercise, but not clinically or statistically significant. And then finally, yoga versus aerobic exercise, there didn't seem to be a difference, which you could interpret as any exercise is good. It doesn't have to be a certain type of exercise. And then finally, when looking at the negative PANSS, so these are the negative symptoms, which again are not super well addressed by medication. And when looking at exercise, it doesn't seem like it addresses that very well either. So comparing yoga to no exercise, again, no statistical or clinical significance. Aerobic exercise compared to no exercise, again, no clinical or statistical significance. And then finally, in yoga versus aerobic exercise, no difference there either. So in conclusion, when we did look at that overall effect, we do see that exercise does seem to have a benefit. And when even looking at those plots where there was no statistical or clinical significance, it did seem to favor towards the exercise, which may just mean more research needs to be done in this area. And so exercise really should be encouraged in a hospital setting, as it seems to have some benefit. There are some gaps in this literature. So no studies included a geriatric population. So even though we were looking at all adults, we weren't excluding those over 65. There was no studies in that. There were also, and part of this could be that the geriatric population maybe wouldn't understand exercise as well. And it's just not clear whether the intensity should be different. So more studies should be done looking at this geriatric population. As well, no studies were done in a pediatric population. We were looking particularly at adults, but no studies were excluded because of a pediatric population. And these people may be more complex. They may have more dual diagnosis or trauma. And so it might help them to engage in something meaningful. And then as well, the studies weren't clear on the length of stay in the hospital. They were clear on the study duration, but not how long the patients were in the hospital. And that could lead to potential atrophy or making it harder to engage. So it might be an important outcome to look out for. So just a couple of really quick pearls of wisdom is, in terms of working clinically with people with psychosis, these are a few of the tips that I learned in my short time working at the mental health hospital. It was really to just take some time to listen to their story. Everybody just likes to be heard. Listening to their preferences as well. So some people do prefer to work out. It could have been part of their past that they really enjoyed. Some people may prefer to play sports. Any type of exercise we see can benefit people with psychosis. finding something to connect with them, and then as well being flexible and patient around their schedule, especially for an inpatient stay where they're meeting with physicians and dietitians and occupational therapists and physical therapists. There's a big team managing them, so just doing your part to be flexible and patient. I also had to learn not every day is going to be a good day, but we did try to make the best of it by playing music, doing different approaches to exercise, like lifting weights or playing sports, or making the exercise a bit more functional so they knew why they were doing it. Really connecting with people based on their hobbies. So, one person was very engaged with WWE. So, we tried to bring that into the treatment as well as any previous history they might have if they previously liked to play hockey, and just connecting with them through that, as well as being flexible about whether they would prefer to be active morning, afternoon, or evening. And sometimes it was based around their treatment as well. So if they had a bout of treatment that made them a little more disoriented, maybe doing it a different day or later in the day when they started to feel like themselves again. The types of exercises really varied as well, and we did try to be flexible with that just to try to get as many people engaged and involved as possible. So, lifting weights, walking around, even just climbing stairs for things to be more functional, trying to challenge the individual, and then really letting them know what exercises we're doing, why we're doing them, and trying to make them feel like they had a little bit of autonomy around some of their treatment with that. And then one thing that I really found was just being there helps. So being another person who's engaged and invested in their care and really trying to make them feel better made a huge difference when it came to working with people with psychosis. So thank you so much for taking some time to listen to this talk, and I welcome any questions.